Well, we're right on time. So, once more, I want to thank all of you for coming today. I think this has been a tremendous session. Uh, my job is to summarize it, but I'm going to use ChatGPT, who's recorded the whole thing and reporting it out to everybody. Before I do anything, though, I want to thank the Lown Institute staff who put this together. So, Noel Sereno, Kelsey Chalmers, Judith. Where's Paula? Paula, maybe Paula's outside. You can say on your way out. Thank you. Aaron Tolio's here. So thank you all. I'm not going to be able to summarize what we talked about, but let me offer you a few thoughts. I have one or two quibbles that I'm going to suppress because I think this is not the time or place. But I'll just tell a story. And the story is that I happened to be having dinner with the former Minister of Health of Switzerland. And he was at Harvard. And he told me how they realized that it looked like there was a somewhat excess utilization of a certain test in primary care offices. And he said, so what they decided to do was use a price mechanism to address that. And so what they did was they just cut the reimbursement of that by 10%. And what happened the next year was the volume went up by 10%, evened out, exactly even, which just tells you it had nothing to do with clinical care. You can extrapolate that to a lot of things in American healthcare. And I think, I have huge respect for Uwe Reinhardt and the work he did around prices. But I think the shocking thing, at least to those clinicians who've really kind of looked at how this works all over the world, the really shocking thing is not that the prices are high here or that the utilization here is similar to the utilization elsewhere. The real shock is you have small inklings in various settings, small experiments that show utilization is high everywhere for a lot of stuff. So I don't have the time to go into that, but it's an important dimension to think about. There's a lot of clinical waste in our system. But that's not why we're here today. So what do we learn? One thing we learned right at the outset is that employers can take the bull by the horns if they're motivated, if they have the right circumstances, but it is not their job to get all the rest of their tribe to become healthcare experts. Nevertheless, it's clear that there are pathways available. And if we were to replicate some of those, we might start getting a snowball effect that would be important. Not necessarily on the economic side, but certainly on the cultural and political side. So that's the first thing I'd say. The other thing we learned is that hospital leadership can be a key part of the solution. Emphasis on can be, and there it's a similar story. What we need is exemplary leaders, then we need a little replication, and we need pathways to the rest of the community to begin tackling this question. Of course, we had a lot of talk, particularly this afternoon, about the circumstances of Medicaid and the current bill in Congress and the prospects of cuts and what the consequences of that will be. And I share with everyone the concern about what we'll see with regard to medical debt. But one thing we did here, not just in the results of some successful state-based initiatives, but the methods that were used, is that there really is a path forward. And that has to do with something I pointed out earlier, but which I think all recognize, and that is the scale and scope of this problem is such that tens of millions of people or on the receiving end. Public opinion hasn't been mobilized around this, but were it to be, then those are constituencies on both the Republican and the Democratic side. And the stories we heard from the states is the pathway to that is not facts and figures. The pathway to that is really creating the common human connection through storytelling. Of course, that's sort of become almost de rigueur these days, but sure, through storytelling. But primarily, the key aspect is that as anybody who pauses, puts down the ideological blinkers and thinks about the issue, takes a moment to think about it, and hears from somebody they know or somebody they're face to face with on these questions, minds change, hearts change, and you can build coalitions. That's what I heard about what happened in the States. And I don't see any reason why that couldn't happen at the federal level. Now, maybe I'm a little optimistic, but I think there's opportunity there. We heard of a lot of incremental solutions, and they're probably good stepping stones to try to build these coalitions. We also heard about some systemic, comprehensive solutions of varying flavors. And I think what we recognized is that the ROI of those is potentially massive, but the pathway is very murky. And it's clear that, as Don Berwick likes to say, quoting many others, probably Charles Deming, that the system is perfectly configured to give the results that it gives. Well, one of the results that it gives is fragmentation, and there's a reason for that fragmentation. The way to overcome that is not through a thought experiment about the perfect unfragmented system. The way to overcome that is to apply energy, an energy of activation, to that fragmentation. That's political energy. And I think that's the only way we'll get the larger ROI that I think everyone senses. That's not going to be short. That's not going to be easy. But it seems to me we're starting to see inklings of how that might work, certainly for the problem of medical debt. So I just leave you all with that idea of hope and the fact that working together and working with colleagues of whatever political persuasion is probably going to yield results. And that's what we all have to resolve to do. I'm going to close things out now by just saying that we don't have a clear set of next steps to offer you, but what we do have, and your program has it, is a QR code. And if you look at that, you can get the final working paper of the working group here on medical debt, which you'll have and you'll be able to utilize. You can also be in touch with Lown. We'll be releasing our database of the hospitals and their financial assistance policies. It'll be interactive, and I think it'll be useful for many people. So if you want to be on the list for that, go to the QR code and get with it. Regarding what happens in the next weeks, months, and year, I think we all would agree it's a very fluid, dynamic situation. It's not clear how it's going to turn out. So we're all going to have to monitor that carefully. We're all going to have to be in touch with each other. But as they used to say, and hopefully we'll keep saying, at the end of the day, it's not about mourning. Don't mourn. Organize. Thank you for being here.